So your child is sick and you know they need to be seen by a clinician, but where to go? Can you go to your doctor's office? Can you wait? Or do you need to go to the emergency room? And when does urgent care come into play? This video will discuss when to go to your doctor's office, ER, or urgent care. And make sure to stay tuned until the end as I go over the top 10 reasons we see kids in our offices for sick visits and when those issues would require an ER visit. So the reality is many issues can be managed by your child's doctor's office. Earaches, coughs, runny noses, etc. It is always nice being able to see a clinician you know and trust and who knows your child's medical history when your child is not feeling well. But of course that is not always possible because that person cannot work 24 hours a day, 7 days a week, and illness can unfortunately strike outside of normal business hours for the practice. But your child's clinician should be the first point of contact for non-emergency situations, routine checkups, vaccinations, and common illnesses. They can guide you on developmental or growth concerns, non-urgent health issues, and minor childhood illnesses that are not emergencies. Most of the time, if your child's symptoms are mild enough, you can wait to see your regular clinician or their office when they're available. And if you're ever unsure, many primary care offices provide triage services where you can call ahead and discuss with a nurse or a nursing line if an issue warrants an in-person evaluation, and if so, if it's an emergency or it can wait until the next available appointment. Some practices also offer telemedicine, which can be useful depending on the issue. More to come in future videos here on this channel about telemedicine and pediatrics. As you watch this video, your access, an ER versus a doctor's office, may also depend on where you live and the resources available. For example, many doctor's offices in the United States may not have labs or imaging like X-ray in their offices, which is why it's really useful when you join a practice to ask, what are my after-hour options in case of an emergency? They should provide you with their nursing line number if they have one, and or the nearest pediatric staffed emergency room that they may recommend. Again, these resources may depend on where you live. So for more questions on what to ask your doctor's office if you are a new patient, download this free handout. A situation that I've experienced as a pediatrician, your clinician may say to come in to see them in the office and direct you to the ER after evaluating your child. Now, this may seem like a waste of time, but sometimes we don't know a full picture until we see you in the office. So look at this as providing you the best care possible by realizing that escalated evaluation in an ER is the best thing for your child. Okay, so let's jump to urgent cares. Now, I have a love-hate relationship with urgent cares as a pediatrician married to an ER doctor, as many of them can tend to overscribe medicines, and if not a pediatric urgent care, they're not used to managing children. Urgent cares are helpful for things that are just that, more urgent. They are really helpful for injuries that need a faster and maybe more thorough evaluation than your office can handle, like minor injuries concerning for a sprain or minor fracture, or minor cuts or burns. They can often perform x-rays and can do some minor wound closure with medical glue or steri strips. Urgent care is also a good option if your child has a minor illness, but your clinician's office is full or closed and are unable to see them. Now, if there's a pediatric urgent care in your area, that would be preferred over general urgent care, especially if your child is young, as not all urgent care providers understand pediatric medicine. If one is not available, general urgent care will typically see a child over a certain age. But again, ask your child's doctor's office where they recommend an evaluation for your child if your usual office is closed or unavailable. Every doctor's office should have this information readily available for you. My order of preference is always having a child evaluated by their doctor or clinician if available and appropriate, or an ER or pediatric urgent care staffed by a pediatrician-trained clinician if higher level of care is needed. Lastly, let's chat about emergency rooms. So this is the place to go when your child is facing a life-threatening concern. Now, emergency rooms are equipped to handle critical conditions 24 hours a day, 7 days a week, holidays, they're open all the time, and have specialized clinicians on standby to evaluate certain cases. For example, for more severe bone and joint injuries, ERs will have an orthopedic provider that they can call in to evaluate and treat your child if needed. This is a great resource to have for more severe illnesses or injuries that may not be able to be managed by a pediatrician's office. The ER also has the ability to order and complete more complex images and labs like CT scans, MRIs, and more detailed blood work that can come back faster than what a doctor's office can get back. Finally, the ER has the ability to admit your child to the hospital if your child needs further monitoring or evaluation. So I know what you're thinking. So if the ER has specialized providers on hand and the ability to complete labs and imaging quickly, and they can do more than my general pediatrician, why shouldn't we go to the ER for all of our problems? Now, if you're in the US watching this video, we want to save you a trip to the ER if possible because ER copays are much higher than copays for a doctor's office. Also, wait times can be really long in pediatric ERs, especially during viral season. So our goal is to triage and see children where they need to be seen and keep emergency rooms for emergencies and doctor's offices for non-acute issues or issues that they can handle. Also, an urgent care and an ER won't typically know your child's medical history. Their primary care provider is the best to manage their overall care for non-urgent issues as they know your child's history best. And if it's not a clinician you normally see, they can pull up your child's medical record using the electronic medical system at that office. Also, urgent cares and the ER will typically not manage more chronic issues as they need to keep their resources available to stabilize and triage serious injuries and illnesses. So they often won't order labs to look into vague but persistent symptoms or order labs or imaging that isn't deemed to be urgently needed. Therefore, it's best to only go to an urgent care or ER if it's truly needed for a more emergent issue. Many times, parents will use an ER for non-emergency situations because their clinician's office isn't open. This is why I hope all of my videos here on PedsDocTalk TV and those to come can help guide you on if things need to be seen at all to save you time and a wait to be seen. But in the end, if you are concerned about your child, they should be seen, whether it's a doctor's office, urgent care, or ER. Now let's discuss 10 common reasons that children can be seen for sick visits and when they should go to the ER versus the doctor's office. I'm not including an urgent care in all of these situations because, like I mentioned, many urgent cares are not equipped in pediatric care, but stay tuned after this list on a comment on when an urgent care may be useful. For all of these, remember that if you are unable to transport the child yourself, you can always call 911 in the United States to assist you. An ambulance provides mobile support. So for example, if your child is having labored breathing and the ER is far, you can call 911 to get medically trained transport on the way to the hospital. Reasons your child needs to go to the ER include your baby is less than 2 months and has a fever over 100.4 taken rectally. For more guidance on fevers, watch my fever YouTube video. They're inconsolable despite meds, and your doctor's office is closed. If you can't get them comfortable and your doctor isn't available, the ER is appropriate. Your child is listless with a fever, and fever-reducing medicines are not helping. Listless means lower energy and less responsive than normal baseline energy. Sunken fontanelles, which is that soft spot on the scalp, dehydration, which includes reduced wet diapers, urination, or intake of fluids, and a future video will discuss dehydration in more detail on this channel. Reasons your child needs to go to the ER versus the doctor's office include stridor, a barking cough, and the child is also in distress. Difficulty breathing and tripoding, their hands are forward, trying to gasp for air. Many coughs can be managed in your doctor's office, but make sure to watch my videos on this channel about coughs and difficulty breathing for more guidance. Many doctor's offices are equipped to handle difficulty breathing as well, but if your child is labored in their breathing, an ER visit is justified, especially if your doctor's office isn't available to see you right away. Reasons your child needs to go to the ER versus the doctor's office include your child is having unrelenting and severe pain, meaning the pain is not coming and going and is constant. There is pain when touching the stomach, especially when distracted. If the child is happily watching a TV show and doesn't wince when you touch the belly, there is likely no issue. But if they wince while distracted, there is pain and imaging may be needed. Reasons your child needs to go to the ER versus the doctor's office include bilious vomiting, which means greenish vomit, to get imaging for a potential obstruction in the digestive system. Your child is not able to keep liquids down despite following instructions from my vomiting video here. The truth is, most rashes do not require emergency care and can be managed in a doctor's office or even on telemedicine if it's a clear video connection. Reasons your child needs to go to the ER versus the doctor's office for a rash include a spreading rash and a fever in a child who looks unwell. The child has a spreading rash and looks unwell, and the skin is peeling in large parts of their body. The child is febrile and listless, and meds aren't helping. Look at the big picture here when it comes to rashes. Most earaches are not an emergency and can be handled in a doctor's office or even in an urgent care. But again, watch my ear pain video for more on when to be concerned to get your child evaluated for an earache. Reasons your child needs to go to the ER versus the doctor's office include your doctor isn't open and your child is in a lot of pain, Motrin or Tylenol aren't helping, and there is no urgent care available. They have swelling and tenderness that is noted behind the ear on a bone called the mastoid process. An urgent care can also manage a sore throat if your doctor's office is closed. They may be able to do strep swabs, which can be helpful to rule out viral versus something that needs an antibiotic, like strep. Reasons your child needs to go to the ER versus the doctor's office include an inability to swallow, there is excessive drooling, past baseline, tripoding, which is their hands leaning forward trying to gasp for air, and or noticeable swelling to the neck. Make sure to watch my head injury video for more. Reasons your child need to go to the ER versus the doctor's office include any loss of consciousness, even if acting normal now, persistent vomiting or nausea after a head injury, hematoma, which is a swelling on the scalp after a fall in any child, especially a baby. Those issues may warrant imaging, and an ER is the best place. I will be doing an entire video about lacerations and wounds, but if the wound edges are gaping, which means that they have to be pushed closed with your finger, they are going to need closure by either Dermabond, which is a glue, or stitches. Depending on the part of the body will determine if stitches or Dermabond can be used. This is a situation where you can call your doctor's office if they're open and see what they are able to do. If they're not open, an urgent care, even if it's not a pediatric urgent care, can most likely handle a laceration so you don't have to go to the ER. If the wound is over a large area and may cause cosmetic issues, you may consider an ER that has access to a plastic surgeon as a specialist to close that wound. Again, this can be expensive and is not available everywhere. You should also go to the ER if the laceration was by an animal such as a dog and the wound has broken flesh. Most non-acute headaches, meaning headaches that have been persistent for a while, should be seen by your child's clinician when they're available. However, there are some reasons an ER visit is needed. Headache with vision changes, headache after trauma, headache, neck stiffness, and high fever that does not improve with fever-reducing medicine, and or the child is not interactive. A headache with numbness or lack of moving any extremity. Headache with slurred speech. So those are 10 common reasons children can be seen for sick visits. Of course, there are many. Remember that an urgent care, even if not pediatric trained, may be useful for the following. If you want a flu swab or other respiratory swab or a strep swab, your child has an earache and your regular doctor's office isn't available. You are concerned of bacterial pink eye and need eye drops. Your child has a minor cut needing stitches or Dermabond glue. You need an x-ray and your child is otherwise stable. An allergic reaction without difficulty breathing. Or your doctor's office has suggested a local urgent care as the go-to for after-hour concerns. Here are some other reasons you may take your child to the ER. Remember that this list is not inclusive of every single scenario, so if you are concerned about the health of your child and your doctor's office isn't available, always know that the ER is open. I hope this video has helped you decide where to take your child when they're sick. Make sure to binge watch all my other health videos here on PedsDocTalk TV that provide more explanation for various issues. Have you ever gone to your clinician or an urgent care or an ER only to be sent somewhere else? Or have you gone to the ER when they sent you back to your primary care provider for follow-up? Leave comments or questions below about your experience with urgent cares, doctor's office, and ERs. And if you found this information helpful, please like and share this video and make sure to subscribe to be the first to know about new videos here on PedsDocTalk TV. Stay well.